Back with Dr. Zhitnitsky. Dr. Zhitnitsky, we talked about missing teeth and that they affect, you mentioned that they affect the body quite heavy. Structure, maybe caved-in phasing, maybe even headache. Never mind, of course, the well-known chewing effects and all that stuff. Now, apparently you have some machine or some instrument which measures the joint movement or something and relaxes something and tell us about it. Has to do with headaches and things like that.
Yes, Helmut. It's actually it's a very widely used machine. It's called a TENS unit. If somebody has ever been to a physical therapy for an injury, they may have been hooked up to a machine. It gives you an electronic stimulation to your muscles. And it causes your muscles to twitch a little bit uncontrollably. It's not an uncomfortable feeling. It's just you sit in the chair and you relax and you let the machine do what it does. And afterwards, we make molds of your teeth, and we actually have a relation of your top jaw to your bottom jaw in the way that your muscles are relaxed. And everybody knows that whenever you have a tense muscle, it can lead to cramping. And a lot of cramping of facial muscles can lead to headaches, migraines, and a bunch of other diseases. So what happens is when the muscles are relaxed, then your whole body is relaxed, and it gives patients relief from pain and suffering.
Wow. And how long does that treatment last?
It's a very easy appointment.
But you said the test. There's obviously first the test, and then there is probably the arranging of the teeth, which might include orthodontic work. It might include all kinds of things, I suppose. But
it could be as simple as making a patient a mouth guard, and usually that's what we start with. It's a non-invasive procedure. It takes a couple of impressions and about 45 minutes in the office, sitting, relaxing, reading a magazine. And then we can tell whether the procedure is effective, and then it's up to the patient to decide whether they want to fix up their teeth to their new bite or just have a bite guard that they use whenever they feel tense.
Got it. And then and again, summarize very fast some of those symptoms it might eliminate, by being tense.
Neck pain, back pain. Pain in the temporal region.
All the way down to the back,
Yes, because your muscles from your neck travel down your back, the trapezius muscles, and gives you shoulder pain and back pain. If your head is not aligned correctly, your spine will not be aligned correctly, and your posture will not be aligned correctly. So everything is related. Like that old adage, the shin bone is connected to the leg bone, and the leg bone is connected to the hip bone. Everything is related. If something is out of whack, it throws everything else out of whack. Especially migraines. People have been suffering from migraines for years, have been able to get relief, not only from medications, but also from this positioning appliance where your muscles are at rest.
Getting rid of a migraine. I mean, that's heavy. Again, if it was like that. I mean, that's absolutely incredible. And it makes a tremendous amount of sense. As you said, everything is connected. We definitely know that. We just keep forgetting about it. And, in a time where an injection in a particular area apparently gets rid of all the problems, we seem to be too much looking at, I have a headache, so I must have a head problem. Well, you do because you have a headache, but it may come from here. Because obviously we have heard from other doctors it can come from a flat foot for that much because it just twists up. So why wouldn't it be twisting up or down from where this very important or complicated joint is from your jaw? Well, maybe we should all go, because there's lots of people out there with headache, muscle tensions. They wake up tense in the morning and we keep changing pillows and all those type of stuff. And maybe there is something else to it, but what you're saying again, get that examination because it might eliminate the problem. And if not, you can keep looking for the other things.
Absolutely, Helmut. And if I could add one more thing, even if you don't have any symptoms, the same procedure has been helping athletes better perform. It balances out their body. It balances out their inner ear, and their equilibrium is much better. And I have patients who are bodybuilders who have achieved maybe extra 20% of more weights they could lift wearing a special bite guard that's made into that position.
Wow. Unbelievable. Unbelievable. So we have headaches,
So
we
any
have
kind-
posture, we
any-
have bodybuilding,
Yes, and any kind of-
better balance.
Any kind of sports you do. I have a friend who's an avid golfer who helped this. There's some people that are basketball players that adds to their athletic ability. It balances out your body.
And don't tell the golfers, I mean, you in California there in Van Nuys, you have like 1 million of them. You won't be able to handle them all. I mean, they'll just line up in front of you. You know those golfers, they do anything for an increased score or whatever.
Oh, absolutely, absolutely.
You know, unbelievable.
We're fortunate to have a place where we can play golf year round.
Yeah. Okay. Dr. Zhitnitsky, thank you very much for this information. It was absolutely unique, I feel. Thank you very much.
Thank you.